So doing online consultations is a little bit alien when you first start, but the way that I describe it to people is it's much like when you first did a telephone consultation. Most of us can recall that period of our training whereby we first started to do consultations over the telephone. It's quite scary, it's unusual. We've spent our careers training, talking to patients face to face, having all those cues that are there that we're trained to pick up on. But over time, we got used to that. We get experience with it, and it's a tool we use every day. No one bats an eyelid at it in general practice. It's a normal part of our working day. With an eConsult, it's the same process. You'll start off, you'll be nervous with it. You're not quite sure what level of risk to pitch this at. But once you get used to doing lots of them, your ability to make a judgment gets much, much better. You get much, much quicker. To add to that, you've got a bit of headspace to actually think about the decision that you're making rather than thinking on the hoof, which is what we normally do in face-to-face and telephone consultations. You've got a bit of time to actually think and make the right decision first time round. The first thing I do, check the name, the age, what the consultation's for, when it came in, and when the patient's expecting a response. Phone number's useful to look at, but you'll probably come back to that if you need it. And make sure that you're aware of the flags and what they look like. These are the two sort of most important ones. One's for requiring close attention and one's for immediate attention. And these ones indicate essentially free text. The first section is probably the most important because that sets out what the patient's expectations are, which is one of the core parts of a general practice consultation. And certainly the first two boxes are the ones that you absolutely need to focus in because that's telling you what the patient wants and why, and helps you formulate your management plan very early on. As you go down further through it, there's a bit more detail about the condition, but it will flag up, as I've already mentioned, the ones which are particularly important. So this one's about headache, and it's got one there saying that this patient's headache's been going on quite a long time. And as soon as I go into the next one, you can see immediately that there's quite an important one there, which are essentially symptoms of a brain tumour. This is one that you must look at, and it's designed so that you don't miss it. At this point, I've probably already made my decision. You probably would have as well. But there is some other important stuff in there that may be relevant to the history. There are lots of sort of positive and negative findings which won't change your mind, but are there just to put your mind at rest. And then some background health on that patient. You've obviously got the medical record to look at as well. So you've got four options when you get to the end of your consultation. So you've got all the information from your eConsult, you've looked in the medical records, you've formulated your plan about what you're going to do. Your four options at that point are you can call the patient up and have a further discussion just to maybe clarify a few points that are either not clear or just to help you nail down a diagnosis or discuss a management plan. The other option is to just do a prescription straight off, and normally you just inform your admin team that that's the plan, and they will contact the patient on your behalf to get a prescription either from the surgery or from a local pharmacy. The third option would be to invite them in for a face-to-face appointment, and that's more specifically for patients that do require an examination, so for instance a testicular lump or something like that. And your final option is to signpost them to another service such as pharmacy. There may be a local befriending service or any of those community services that exist that a patient could utilise rather than the GP surgery and that's more appropriate for them. That's your fourth option. So the other notification that you might get in a risk report is a photograph which comes through on certain conditions like styes, conjunctivitis or skin conditions. The photograph will be within the risk report so you can look at it and review it, and the files also come to the practice with the eConsult so you can look at it in higher resolution. On certain consultations that will come through for certain conditions such as anxiety and depression, it will include the evidence-based scoring mechanisms so that you can also ascertain how seriously ill they are. In this particular instance, someone's got a PHQ-9 score of 19, and it also flags up the actual breakdown of the answers that have led to that score. So take urinary tract infection as an example. Traditionally that consultation would be someone coming in, sitting down, having a 10-minute consultation. You might want to dipstick their urine in some cases. With eConsult, that history is crammed very, very quickly into about a 2-minute read, and you know immediately whether you're going to treat that patient with antibiotics or whether you need a urine sample or not. But it takes a very, very short space of time because of the Health Protection England guidance on the urinary tract infection.